Cranfold Physical Therapy Centre.
My name's Wendyanne Harrison. I own Cranfold Physical Therapy Centre, which we established 14 years ago. Started off in Ewhurst and moved into Cranleigh, and have moved a couple of times with the building being renovated. And we've been in these premises now for 2 years, and this is now home.
Right.
So hopefully we're staying here now. We also have premises in Dorking and Horsham, but Cranleigh is definitely our home.
Why is Cranleigh your home then? Is there a connection between your family or something? Or?
Yeah, I live in Ewhurst, so always nice to have not to commute too far, which
Right.
is lovely.
Yes, indeed. So born in Ewhurst, or did you move
No,
here?
not at all. No, I've lived here 20 years, so it has become home.
Right,
Yes.
okay. And tell me a bit about where the work that you do sort of sits in terms of other things like an osteopath or a chiropractor. Where does it blend in?
There's a lot of overlap. Physiotherapy will treat pretty much anybody who has a painful condition or is getting over an operation. So we do a lot of rehabilitation. But there is increasingly little difference, I think, between the three professions. As we learn more and as we research more and find out what really works for people, I think practice is evolving and changing. But I suppose looking at the three, chiropractors do very much a strong thrust, short, sharp techniques. Osteopaths will also manipulate, but tend to perhaps do a little bit more hands-on soft tissue work, also use some of the machinery that we use like ultrasounds. And physiotherapists probably are a little bit more gentle, lower amplitude techniques
Right.
for our hands-on treatments. And we also tend to give a lot of exercises, advice, homework, because we believe it's a partnership between us and the patient, and what they do for the time that they're not with us, which is an awful lot longer than they are with us for, is very important to understand what will help them and what may be detrimental to them. So
Right.
a lot of nagging and education goes on as well.
So you give them lots of homework.
We do.
So how does it feel when people come through the door and they're in pain? I mean, put bluntly, it must feel really good to.
It is lovely, actually. And what's a real privilege about living and working in Cranleigh is you get to know people on a very personal level. When we work with them, we're spending 45 or 30 minutes with them each time. We may see them at least 4 or 5 times. That's actually quite a lot of one-on-one time with somebody, and you get to know an awful lot about them. It's quite important to know about them. We're not just being nosy, but we need to know, what are they going to do with their shoulder or knee? Are they, a tennis player? Do they work in an office all day? And it's important that we rehabilitate according to their conditions. So therefore, we're asking and finding out an awful lot about what they do. And along with that, obviously, they tell us a lot about their lives, which is great. So that's nice.
So I guess I came in with the impression that it would mostly be people injured as a result of sporting activities, but it's wider than that.
It is wider than that. We do see sports activity related problems, but we also see a lot of arthritis. We see people who've had accidents, car accidents. We see a lot of back pain and neck pain. Some of that is just insidious. We sit a lot. We sit in cars. We travel to work. We sit in the office. We use our computers. Laptops and iPhones are horrendous. Wonderful things, but we're not really designed to sit still. We are movement machines, and when you stop moving, you can create a lot of problems.
So what are you advocating then? Banning desks and chairs in offices and all of us standing up?
Not at all, but I think trying to remain active in the day is important. Not staying fixed. Getting up and moving around is definitely important.
Right.
There was a programme on TV the other day which took all the desks out of a estate agent. I don't know if anybody saw that one.
Yeah.
Made them have standing desks, and just for a week it made a huge difference to their general well-being and health, which was interesting.
Interesting. Maybe I'm going to take that bit of advice back to the office.
Yeah, get rid of your desks.
How do people find you? I mean, obviously you're there on the high. You're on the high street, but
Yeah.
Are referred to you? Or?
A mixture. We've been here a long time now, which is great. And what's lovely is that 50% of our business comes to us through people recommending us. And we love that because it means that we've done a good job, hopefully, and that people are happy to use us as a service. So that's really nice. We get quite a lot of GP referrals as well. Some of the consultants, when they've done an operation on somebody, if they live locally, they'll recommend us too. So it's a good mixture.
Okay, it's a question we ask everybody that we talk to, or 2 questions really. One, what would you have done differently in terms of getting to where you are today, That's the first question.
Well, that's a
What would
tricky
you
one,
change?
actually. I think I've obviously made some mistakes along the way, and I think we've sort of evolved. You learn a lot, I think, through your own mistakes. I don't think we've made any horrendous mistakes. I like the fact we've been able to own our own premises. That is a huge comfort for me, because we actually have 25 people who work at Cranfold, and that's quite a responsibility. So I need to know that we have some security, and that everybody hopefully has a future with us. So that was a very big benefit to us.
I mean, that's quite a sizable employer for a village.
I suppose it is. I mean, everybody is part-time, so they're not full-time employees, but it is. That in itself, I think, is quite nice, because people come to work wanting to be here and wanting a break from home, and it's quite nice to have a good mixture of enthusiasm.
Yes, indeed. If we were to sit down together in 5 years' time, what would be different? What would your practice look like then?
I think in Cranleigh would look similar. The biggest growth area we have at the moment is in the small classes that we do. We're very lucky here that we've been able to build a small studio, which gives us room to do quite individual classes, really. And I think people are finding that a very useful add-on to their physiotherapy. So when they've got better, they'll come and do clinical Pilates or rehabilitation classes under the guidance of a physio. I can see that continuing to grow further, and people being more interested in their well-being and prevention rather than just waiting till something goes wrong.
Right.
So that possibly is the way that it's going forward,
Okay. We're not going to do it, but if we were to grab a load of your patients as they were coming in and out and said, why do you come here? Presumably there is choice. Why would they come to Cranfold?
I'd like to think they come to us because they will get a professional service, but also a very personal, friendly service. As I say, we do get to know people very well, and we very much enjoy that side of it. And hopefully that comes across when we're treating patients, that they're not just a patient coming in to get better, but we have an actual interest in, wanting to see them progress. And it is lovely when you see somebody hobble in, really unhappy on crutches, and sometimes you think, gosh, they're a really quite grumpy person, and then over the weeks they just become the person that they should be, and that's a really nice thing to be involved in.
Excellent. Thank you very much. It's been
Pleasure.
enlightening.